right to the camera, sweetie, like right here.
Talk to me, because I'm listening.
Talk with me, so I feel important.
Hello there, my name is Ranger Ray, and when I meet a new friend for the first time, I like to say something about myself. It makes them feel more comfortable. For example, I like to walk my pet duck Moose.
Engaging with a child on a social level, spending 30 seconds or a minute, checking in with them. How was your day? How are they doing? Before you start talking about any relevant medical information. This can be such an effective tool in communication.
So what I'd suggest to anyone who wants to improve their communication with young people, especially teenagers, is to listen more than they speak. When you need to speak with somebody, I'd suggest asking more than you're telling, because the more you're asking about who they are and what they're about, and the more you show that you're listening to someone, the more they're likely to open up to you. You actually get to know them, and you get to know where they're coming from.
Just because sometimes I have trouble saying what I want to say, it doesn't mean it's less important. I don't like when people laugh about my stutter.
Treat him just like any other person having a conversation.
It's not how they say it that counts, it's what the person is actually saying.
As a psychologist, one of the things that I find most valuable in talking with children and teens and young adults is encouraging them to take on a role as the expert. They're the expert in their experience, they're the expert in their knowledge, they're the expert in their day-to-day life. So give them a chance to tell you what they know.
So this is my chair, so I have the right to decide who can touch it and when. And if they have to, I have to give them permission, and it's my choice for them to touch it or not.
Talk with me in a way that I can understand.
It's important to explain things using a language a patient can understand based on their age and development. And remember, come down to my level.
It's important to be aware of your body language and its meaning.
Please face me when you talk to me. If there is background noise, please close the door or go to a quieter room. Please provide written instructions in case I miss anything.
Talk with me recognizing I may not speak or understand English.
Trabajar con intérpretes para tener la comunicación efectiva cuando se revela que tiene uno una barrera del lenguaje.
وجه انتباهك للمريض عند مخاطبته وليس للمترجم، فالمترجم هو فقط صوت لإيصال المعلومة.
Talk with me even if I'm unable to speak to you.
As a speech-language pathologist, it's important to recognize that children communicate in different ways. They can communicate verbally through speech, or they can communicate non-verbally using technology, gestures, facial expressions.
Ask how my child communicates. Cristiano, can you say yes? And how do you say no? Good job. Can you say thank you?
One of the most important things in managing patients with tracheostomy and ventilation is arming them with some skills for communication after tracheostomy is placed. And the other piece of information I like to tell healthcare providers is remembering that a lot of these patients do not have intellectual disability. So making sure that you do approach these patients directly, let them know what you're going to do with them, and ask them how you would like to communicate with them.
I work with a lot of kids who don't have much language. If they were here right now, what would they say to you? They would say, talk to me. Just because I can't talk to you doesn't mean I'm invisible. If during your conversation with my parents you find that I'm starting to make noises, or wave, or laugh, or cry, stop. Take the time to find out what's going on, whether I'm upset, whether I'm happy, whether I'm bored, and find out most of all how I say yes and no so that you're clear on my answers.
Talk with me so that I am confident that I am getting the best possible care.
I always take respect and privacy of our patients very seriously, so I always make sure I knock before I enter a room. I introduce myself. Hi Connor, it's Stuart, and I double check if it's okay for me to enter the room. Is it okay if I come in? Perfect, thank you.
Being in the hospital for
1, 2, 3 weeks or more, it can get pretty weird. So it's nice when people ask for permission and stuff before just coming on in. It makes it feel like a safe space. And same with like procedures. It's a lot nicer when someone's asking you if they can check your blood pressure or change an IV than if they're just grabbing you all over and pulling stuff. It's nice. It's safe.
My daughter is 2 years old. She has a rare tumor and she receives treatment every week. One of the things that I think her doctors do really well is they speak right to her. They make her feel comfortable. They make eye contact with her. Sometimes they come in with a little toy or a bell or something for her to play with, which helps put her at ease.
So whenever I go in to talk to one of my patients, I think the biggest thing that I keep in mind is I don't have to have a specific agenda of my own when I have these conversations. The conversation is really about what the patient wants to talk about. And I really let them lead the agenda. And I'm just there to give these kids a really safe environment for them to express any worries or fears that they may have.
Talk with me. I'm listening.